You cannot continue to stand on the fence. You must decide which side you belong. You cannot be indecisive. If you are pre-diabetic, you cannot remain pre-diabetic for long because you are at the risk of becoming diabetic. So you must reverse pre-diabetes. Pre-diabetes is not a resting zone. It's a warning zone. It's a place in which you must do whatever it takes to reverse it. Because if you become so comfortable with being pre-diabetic or at the border as they call it, you will likely become diabetic. And you should know that pre-diabetes is easy to reverse as long as you're going to follow the instructions on diet, exercise, and change in lifestyle. If you are to follow that, you can easily become normal. But if you refuse to follow the instructions, as many do, in no time you become diabetic. I've seen a lot of patients that previously were known to be pre-diabetic, but now they are full-blown diabetic. And the reason being because they were told they were at the borderline, so they became relaxed. They did not take any step to reverse the pre-diabetes. But a lot of people that took the necessary step are now normal. But the important thing is, whether you're normal or you're pre-diabetic or diabetic, you must continue to follow the instructions in terms of diet and exercise. So the question here is, what is pre-diabetes? Pre-diabetes is when you do your fasting blood sugar according to WHO that is between 6.1 to 6.9. Or if you do oral glucose tolerance test, OGTT, and after they give you glucose, 2 hours later your blood sugar is between 7.8 to 11.0, you are pre-diabetic. Or if you do a more sensitive test like glycated hemoglobin, HbA1c, and is between 5.7% to 6.4%, you are pre-diabetic. So why are we concerned about pre-diabetes? Apart from the fact that if you're pre-diabetic, you may progress to develop diabetes. At the stage of pre-diabetes, some people have already started developing complications. Problem with their vision, they cannot see clearly. Some will be having burning and tingling sensation on their hands and feet. Some people may have fertility issues. So it is important that at the pre-diabetic state, you reverse it and reverse it early so that complications will not develop and so that you will not be late. Because some complications, when the damage is much, reversing that damage may be difficult. You can only delay the progression. So, as I said earlier, you cannot be in the fence. It's either you have decided that you want to progress to be diabetic, or you have decided to reverse pre-diabetes to be normal. I think you should choose the latter.